afternoon to Prof. Gaya. So we are from Group 1. So today we are going to introduce about our essay topic, which is about importance of pragmatics related to the communication and the communication disorder, which our group choose. Our group topics is about autism spectrum disorder (ASD). So now all of us will take turns to introduce ourselves. So my name is Jale.
My name is Amen.
I'm Fatsvina.
I'm Wei Tong.
And I am Alicia.
So now we proceed to the introduction part. So now we will be taking turn to explain about our part. So I'll be explaining about the introduction. So basically, for introduction part, for the first paragraph, I'll focus about the background of pragmatics. So I will highlight about the pragmatic has his own historical roots, like in ancient Greek, Roman, and pre-Chin Chinese thought, where scholars will recognize that meaning beyond literal words. And then I also highlight it in terms of a modern linguistic perspective, like Charles Sanders Peirce emphasized that meaning depends on interpretation. For the second paragraph, is more related to contemporary understanding of pragmatics. Like today, the pragmatic is viewed as a socially grounded aspect of language, and it also focuses on language is used appropriately and effectively in our real life communication. So I'll also take some examples from one like Thomas that emphasize meaning, negotiation, context, and speaker-listener interaction. Thanks for paragraph 2. And next, in paragraph 3, I'll highlight about what pragmatic works and what does it different from vocabulary and also grammar. So the pragmatic is distinct from vocab and grammar with why. And so I'll give example like a child may have a strong language skills but still struggle socially in the communication. So pragmatic competence requires understanding of social rules, implied meaning and context, and not just linguistic knowledge. It's about my paragraph 3. Well, paragraph 4 is all about supporting pragmatic development. So I will show some research that shows that pragmatic cannot be developed through direct instruction alone, and we should incorporate like play-based and interaction focused approaches that are more effective. So I also highlight some articles, some programs that I get from the articles that I observed, like Inspired, which are highlighted here from Inspired program cover 2025. So it focuses on the observable social behavior such as eye contact, communicative intent, and reciprocity. Next, about paragraph 5 is about core pragmatic skills. So in this paragraph, it's quite straightforward. I will highlight about some key examples of the pragmatic skills like turn taking, topic maintenance, eye contact, and using language for different communicative purposes. So these skills are very important, and it supports effective conversation, social relationships, and also responses in different communicative contexts. So last paragraph for my introduction is a relevance to autism spectrum disorder. So it acts as an opening before we delve into the discussion below. So I will highlight about the common pragmatic difficulties that are particularly prominent in children with ASD. And I'll also highlight that many children with ASD may have intact vocab and grammar, but still struggle with social use of language. So this will lead to the focus of the essay, which examines like the pragmatic difficulties in ASD and their implications. So that's all for my introduction part. Pass it to next person.
Alright, so the next part of the essay, we will discuss the deficits experienced by children with autism, the deficits in pragmatics. And so in this paragraph, what I focused on was just the deficits that they experience themselves, and I referenced DSM-5. So among the deficits that they do experience are abnormal social approaches, failure of back and forth conversation, reduced sharing of interests, emotions, as well as a failure to initiate or respond to social interactions. And then there are also deficits in their language and also their emotions, as in they cannot share emotions, and they also have little to no initiation of social interaction. And in this next essay, in this next paragraph, I highlighted how the deficits could affect them in real life. So the focus would be in friendship, in their activities of daily living, and instrumental activities of daily living, as well as in their participation of activities, and also in familial interactions. So for uh, deficits in, so how does a deficit in pragmatics affect friendship, is that children with ASD usually experience poor friendship quality, and they also experience higher levels of loneliness because of that. And then in daily living, the deficits usually affect their participation in activities, especially activities that require a higher social demand. So activities like religious activities, and community activities like playing in a public pool or inviting friends over, those are usually the activities that they would have issues with, because these activities require higher social demand. But the deficit in pragmatics is not the only reason. There can also be other factors like the child's own preference, and other barriers like physical and environmental barriers or financial barriers. And then in familial interaction, the deficits in pragmatics that they experience usually affect the parent-child interaction, because in the study specifically, they are found to be less responsive towards their parents. And for siblings, they would have some aspects of the sibling relationship would be normal, but some aspects are a bit different. And those aspects are different are that they have less intimate relationship with their siblings, and their typical sibling would usually be can be less nurturing towards the sibling with ASD. So we're going to move on to the next part.
Alright, so after understanding what pragmatic skills are and the types of the pragmatic difficulties that children with ASD may experience, now I'll be focusing on why pragmatic skills are so important, particularly in like everyday communication and also for their long-term development. So first thing first, pragmatic skills are prominent because successful communication is not just about speaking clearly or knowing many words. A child, they may have like good vocab and grammar, but communication can still break down if they struggle to use the language appropriately in social contexts and situations. So, for example, a child might say like, "I want that" repeatedly without like making eye contact. So pointing or like waiting for a response. So linguistically, the sentence is correct, but socially, the message, it may not be understood by the other parties. So in everyday interactions, like in classrooms or like in playgrounds, it would often leads to misunderstandings rather than successful communication. So research in child communication consistently shows that pragmatic governs how language is used in real life interactions, such as how conversations are started, how turns are managed, how meaning is adjusted for different listeners, and how nonverbal cues like facial expressions and also the tone of your voice are interpreted. So in other words, grammar and vocab, it gives the children the building blocks of language, but pragmatics is the one that tells them on how to use those blocks meaningfully. So without pragmatic competence, communication, it may be linguistically correct, but socially ineffective. Yeah. Um, so pragmatic skills, it plays a major role in a child's social life. Evidence from studies on peer relationship has shown that children who struggles with pragmatic skills often find it difficult for them to form and also to maintain friendships, even to like form meaningful relationship with their friends. Even when their speech and language abilities appear adequate. So these children, they experience this social isolation because they struggle with reciprocal interaction, shared enjoyment, and also for them to understand social cues. So when talking in educational settings, pragmatic skills are equally important. So research examining classroom participation has shown that pragmatic competence, they strongly influence a child's ability to follow instructions, for them to participate in discussions, and for them to work cooperatively with peers. So in many cases, pragmatic skills are more closely linked to classroom success than their speech clarity alone. Pragmatic also, they support emotional regulation. So evidence has from the studies has shown on emotional development indicates that when child are unable to express their needs clearly or understands others' intention, frustrations and anxiety would often increase. So over time, these repeated communication breakdowns, it can contribute to emotional dysregulation and also challenging behaviors that we often see in children with ASD. So, while pragmatic skills are important for all children, they are especially critical for children with ASD. So, social communication difficulties, as we know, it is a defining feature of ASD. It's not an additional concern or a secondary concern. Research has consistently shows that children with ASD, they experience significant difficulties in their pragmatic language, even when their vocab and grammar are relatively intact, like I mentioned earlier. So these challenges affect how these children with ASD would initiate their interactions, maintain conversation, and also to interpret social cues. So because of this, these children with ASD, they are often misunderstood. They may appear like they are uninterested or uncooperative or socially withdrawn from other people, but in reality, they actually lack the pragmatic tools that's needed to navigate the social interactions effectively. So when we are able to view these behaviors through a pragmatic lens, it helps to shift the focus from behavior management to communication support. All right, now we're going to talk about the importance of pragmatic skills as it's been reflected in the diagnostic frameworks. So current diagnostic guidelines identify persistent difficulties in social communication and social interaction as a core criteria for ASD. So these criteria include challenges with social reciprocity, nonverbal communication, and also developing relationships, all of which are fundamentally pragmatic in nature, which highlights that pragmatic difficulties are central to how we can understand ASD and how we can assess and diagnose them. So clinically, this means that pragmatic skills, it should be a key focus during assessment and also intervention planning, rather than for it being treated as a secondary concern. Next, for in the long-term outcomes and also why early support would matter is that evidence has from the long-term follow-up studies has shown that pragmatic difficulties in ASD, they do not simply resolve with age. So without early support, these challenges would often persist, starting when you are in adolescence. It may persist when you are entering your adulthood, which would affect their social participation, also independence. So on the other hand, evidence also shows that early intervention targeting these pragmatic skills, it can lead to improvements in social engagement that would be explained further in the next presenter, which highlights the importance of addressing pragmatic skills as early as possible. So basically, to conclude everything, for the importance of pragmatic skills, they are essential because they shape how children use language to connect with others, participate in learning, and also to manage everyday social situations. So for children with ASD, pragmatic difficulties, they lie at the core of the condition and have far-reaching effects if left unsupported. Therefore, strengthening pragmatic skills, they are not optional. It is fundamental to improve communication, social participation, and also for their long-term independence. Yes, that is all for my part. Thank you.
Okay. Okay, now that we know the importance of addressing social pragmatics issues, we're gonna talk about how therapists strategize and how they actually target the teaching of social pragmatics skills, especially in children with ASD. So before we actually talk about the actual techniques, we go throughout history to look at all the different approaches that therapists throughout time have adopted into their therapy. So for example, the first one, of course, when we talk about ASD and social pragmatics teaching, we need to look at ABA and the precursor to it, which is the behavior operant condition by Skinner. So this principle of operant conditioning, which eventually evolved into ABA, applied behavioral analysis, which then also has its constituent techniques such as discrete trial training. All of these are very classical therapy approaches that are applied in teaching not only language but also social pragmatics in children with ASD, whereby each of these activities are broken down. We talk about how these activities are conducted and the principle behind them in this part of the essay. Next, we also talk about the critics to the approach and how these critics have actually helped the approach evolve into the more contemporary approach that we use today, even while still maintaining some of its core identity. And some approaches actually even take a 180-degree turn, not following this approach. So we explore all the different approaches in teaching social pragmatic skills in children, especially with ASD. So some of these critics include that the therapies are often conducted in a very sterile environment that may not reflect how a natural environment of children is, and it's most of the time the therapist takes a center role in conducting the therapy, sometimes to the point that parents are unable to carry the therapy work at home, because in order to conduct these therapies, the clinician needs to be highly trained in their very specific skills. Okay, so over the years, we have seen innovations, one of them being milieu teaching, and in which environment of the therapy or environment of teaching of these social pragmatic skills slowly become less and less sterile and become more naturalistic, but with some minimally pre-manipulated environment to encourage naturalistic settings for the child to encounter learning experience on their own. So the environment is still manipulated, but it is more reflective of a child's natural settings. So we see over time, we see approaches like Hanan, It Takes Two, and Hanan More Than Words program evolving from the milieu teaching concepts and milieu teaching principles. In fact, not just that. In fact, the aforementioned ABA has also experienced various changes and evolutions throughout its development, now called New ABA, which focuses more on NET, or otherwise known as Natural Environment Teaching, and NDBI, Natural Development Behavioral Intervention. So we talk more on these things. Because children with autism, because autism is a wide spectrum, most of these teachings are not followed, most of these approaches are not followed from A to Z. In fact, a lot of its concepts are taken and adopted to best fit each individual children's needs. So some of these, we also list examples of specific techniques, not just approaches now. Now we go deeper into each of the approach, the techniques that are used in child-centered approach in teaching socio-pragmatics today. So we have the environmental, as we said just now, whereby a typical developmental social pragmatic therapy, parents create a setting that interests the child, like setting up a play area with the child's preferred toys in view, and they encourage the child to interact with these toys. For example, they put a favorite toy out of reach to encourage the child to ask for it. So this is a way to manipulate the environment to push and encourage social pragmatics development in children. We also have people games with the utilization of ROCK, or this is developed by Hanan, which is repeat. ROCK stands for repeat, offer opportunities, queue for the opportunities, and keep the interaction going. So this is like people play when you do Ring Around the Rosie, for example, you play London Bridge, where you play a game without toys, but with people instead. Actually, even in Malay, we probably can utilize or we can apply games like Tom Tom Ba Ma Ayom. They like play with the kid, and the kid actually has to are forced to socialize in order to play. And then we have social stories or social scripts by Carol Gray, developed by Carol Gray. Usually, we have pictures of social situations in which children with difficulties in understanding social pragmatics in interaction can learn in a very educational way. So they can look at the pictures. Usually the storybook will have real life pictures. Yes, to signal what children, and so that they can learn what they can say when they meet new people, what they can do when their feelings are hurt, how they can show appreciation through these social stories. We also have performing and acting out those social stories. So you can do role plays of the social stories to make the social stories more engaging and personal. And we also have modified DTT, discrete trial training, for non-verbal communicators to teach gestures, eye contact, and taking, but in a new and more contemporary ways that actually encourage the child to learn in a naturalistic settings. Okay, that is all for strategies used by therapists. Next.
All right, next I'll be explaining the role of parents and practical home strategies in stimulating pragmatic skills in children with ASD. And I organized these to 5 main paragraphs where I address a key component of parental involvement in pragmatic language development. For the first paragraph, I discuss the foundational role parents play in the development of pragmatic and social communication skills in children with ASD. I highlight that parents are the child primary communication partner and serve as a consistent pragmatic language models through daily interactions. And based on the findings by Wacana and XD, parents who have good pragmatic skills such as appropriate topic maintenance and reduced directive questioning is associated with better expressive and pragmatic language outcomes. And this paragraph established that the children with ASD often struggle to acquire social rules implicitly. Explicit and consistent modeling at home is particularly important for pragmatic skill development. And next will be the second paragraph. Sorry, hold on. All right, the second paragraph focuses on the empirical support for parent-implemented interventions. I reference systematic reviews showing that family-mediated approaches lead to improvement in joint attention, social engagement, and functional communication. And the evidence-based programs such as pivotal response treatment, early start Denver model, and JASPERS are discussed to demonstrate how parents can be trained to embed pragmatic targets into play and everyday routines. And this paragraph emphasizes that when parents receive structured guidance, they are able to facilitate pragmatic development effectively outside of clinical settings, supporting the generalization of skills at home. And the third paragraph, we go to naturalistic strategies and everyday routines that can be done. And I expand on specific naturalistic communication strategies that parents can use at home, such as modeling, man modeling, and time delay, as supported by studies by Kaiser and Roberts. These strategies increase communicative initiations and reciprocal exchanges by reducing interactional pressure and encouraging child-led communication. And it integrates the importance of embedding pragmatic targets into everyday routines, such as meal times and play, which has been shown to enhance functional use and generalization of pragmatic skills across contexts. And for the fourth paragraph, it addresses the role of coaching, feedback, and collaboration in supporting parents' effective implementation of strategies. So based on research by Roberts and Kaiser, I explained that parents demonstrate higher strategy fidelity and confidence when intervention includes live coaching, video feedback, and collaborative goal setting. So that sustained professional support enables parents to adapt strategies to their child's developmental needs and maintain consistent use over time, which directly contributes to their improved pragmatic outcomes. And the last paragraph is about responsive interaction and long-term outcomes. So longitudinal studies by Adamson and colleagues and Kaisari and colleagues to show that early joint engagement predicts later pragmatic competence. And this paragraph concludes that reflective and responsive parental communication creates an optimal environment for flexible and socially appropriate language development in children with ASD.
And lastly, as actually we have a conclusion part also, but actually we are still in the process of refining our conclusion as we have to we have a few points to revise, and we will wait for Prof's opinion first, and also feedback from Prof before we can proceed with the conclusion. I think that's all for our presentation today, and thank you, Prof, for listening. Thank you.
Thank you, Prof.